This is Louise McCabe and Alison Dawson from the University of Stirling team on the RemoDem project. The RemoDem project was a cross-national study of support and care needs of people with dementia and their families living in remote and rural areas in Europe. The project was funded by the Northern Periphery Programme. The project involved field sites across Northern Europe, including Northern Sweden, the Faroe Islands, Shetland Islands and the Western Isles in Scotland. As part of the project, a decision support tool was developed. This support tool was designed for service providers and carers and families of people with dementia to give them access to information to help them develop ways of supporting people with dementia living in rural and remote areas. The tool provides access to technical data and to available evidence around interventions and methods of support, and it enables people to generate modules of support in different care domains and which can be made applicable to local circumstances. The tool covers seven modules of support of relevance to the person with dementia, to their family and other caregivers, to professionals and practitioners, and for community members and organisations. The modules start thinking about direct support of a person with dementia, but they also include things like community awareness and service integration. So I'm now going to show you a little bit about how the tool works.
Hello. The decision support tool is in a spreadsheet format, and there's a worksheet for each of the modules. Each module worksheet is arranged in the same way in terms of columns and has the same headings, and the best way to show you how the decision support tool works is to use an example from one of the modules, so we're going to go to that now. The first thing to notice is that for each module there are a number of subtopics, and each is given a separate row. So this particular subtopic is about the kinds of assistive technology that can support people with dementia in going outdoors. The support gap that it's designed to bridge is around supporting people who may be in danger of becoming lost. The first thing that we did was to look at what RemoDem team members were already doing. And in the Faroe Islands there was already a system in place using mobile safety phones which had GPS tracking enabled. We supplement that information with evidence from the systematic literature review carried out as part of the RemoDem project, which showed that there was weak evidence supporting the use of such tracking devices, and also considerable debate in the research literature about the ethics of tagging individuals. The expert comment from the Stirling team showed that in fact where the perspectives of people with dementia and their carers had been taken into consideration, they were in fact very positive about the use of such devices, because they were perceived as providing an additional safeguard for people with dementia. In the decision support tool we provide for each subtopic examples drawn from the technical review carried out by Luleå Technical University as part of the RemoDem project, and also from the guides available from Stirling's Dementia Services Development Centre. In this instance we give the example of the body tracking device, but there are many such other devices commercially available. And in fact in the relevant resources column, which comes next, we note that there are 19 different such devices listed in the AT Dementia website, which we provide the link for in the tool itself, so that users of the tool can go and have a look at what's actually currently available. The final column in the support tool draws the lessons from RemoDem, and in this case the field sites in Faroe Islands and Sweden both tested GPS tracking devices, and the overall response to these was very positive. particularly from families and from community staff, in addition to people with dementia, because both of those groups felt that there were reduced levels of stress and anxiety associated with allowing a person with dementia to be more independent. If you would like any further information about the decision support tool, please look at the RemoDem website.
Thank you.